culture is the gold standard test for diagnosis of sepsis. It is to be done in all cases when sepsis is suspected, preferably before starting antibiotics. In this video, we shall see the important steps which are required to be followed when a blood culture sample is taken. The important steps are taking an informed consent, hand washing and selecting an appropriate vein, collecting all the equipment which is required, and then do not forget to wash your hands again before you take a blood culture. Don on the gloves, prepare the skin, do a venipuncture and take the blood culture sample. Remember that the blood culture sample has to be inoculated in an appropriate blood culture bottle. Shake the bottle and then label it and store it under appropriate conditions. Last but not the least, document that the blood culture has been taken for that particular infant.
The first step of taking a blood culture is obtaining consent from the parents. It is essential to obtain consent from the parents before sampling. They should be explained about its benefits, the risks involved, and the need for the procedure in their baby. The second step is hand washing. Thoroughly wash hands before arranging the items required for the procedure and selecting the vein. The next step consists of preparing for the procedure, which involves arranging the materials required for the procedure and appropriate selection of a vein. Firstly, locate a tray or trolley and have it covered with a sterile sheet. Here, items for the procedure will be placed. For the procedure, we need 2 spirit swabs, 1 betadine swab and a few dry cotton swabs. The spirit preferred is 70% isopropyl alcohol and the concentration of povidone iodine or betadine should be 10%. Next, we need 2 pairs of sterile gloves. One to arrange the swabs and assess the vein. The other for the actual procedure later on. Make sure that the swabs are not over-soaked. Also, ensure that the swabs do not touch each other. We also require at least 2 disposable needles of 24 or 26 gauge and 1 disposable syringe of 1 or 2 milliliters. And last, but not the least, a culture bottle containing about 20 milliliters of trypticase soy broth or TSB should be placed on the tray. Ensure that its date has been checked and the leucoplast seal is untampered. Slightly peel off the edge of the tape over the cap so that it would be easier to remove it later. And also remember to clean the cap with 70% isopropyl alcohol. The selection of vein is an important step. It is preferred to select a site with a vein which is straight and coarse of medium caliber not overlying bony prominences, and not thrombosed. The desired site is the dorsal aspect of the hand. Once the sampling trolley is ready and proper vein has been selected, the person sampling needs to wash hands again, since the hands have now become unsterile. Hand washing should be done following the standard steps. After hand washing, the person sampling must wear sterile gloves of appropriate size. Now we come to the vital step of skin preparation. Proper skin preparation is very important. Skin preparation or disinfection is done by swabbing the area of about 5 cm diameter with spirit, povidone iodine, and then spirit again in that order. The swabs should always be moved in a circular motion as shown, with the estimated point of venipuncture taken as center, and then the swab being moved outwardly. Apply the swabs with friction. An important point to note here is that after each swabbing, you must let the spirit or povidone iodine dry in air. Always ensure that you allow drying in air even if you are short of time. Also, pay attention that swabs are not over-soaked. In the next step of venipuncture and sampling, firm grip of the hand or foot is very important. The disposable needle of 24 gauge or 26 gauge is preferred for pricking the vein. With the bevel kept upwards, the tip of the needle should pierce the center of the disinfected circular patch for venipuncture. Gently applying pressure from the finger's side while occluding at the wrist will help in maintaining the blood flow for enough sample. Gradually, the blood will start oozing out of the hub. Then, insert the tip of the needle of the sampling syringe into the drop of the blood about to trickle down the hub. Here, be careful that the tip of the needle of the syringe does not enter inside the hub, letting the blood out. Aspirate blood of 1 to 3 milliliters in volume slowly in the sampling syringe, being careful not to aspirate too much air. After drawing the blood sample of required volume, pressure is applied at the venipuncture point to stop more blood from coming out. Next, we proceed to inoculation of the blood sample drawn into the culture bottle. While inoculating the media through the hole, ensure that the tip of the needle does not touch the area of the cap which is not disinfected. After inoculation has been done, do not forget to roll back the adhesive tape covering the hole on the culture bottle's cap. Also, take care to apply enough pressure with a dry cotton swab for adequate duration at the venipuncture point to prevent untoward bleeding. The needle of the syringe used for inoculation should be carefully placed into the cap on the tray. After inoculation, the culture bottle should be properly shaken so as to mix the blood sample with the culture media well. This can be done placing the bottle in between the palms and then rotating as shown. The last but important step of the procedure is to label accurately and store appropriately. Ensure the exact identification details of the baby on the label. The requisition form is an important document and so has to be filled completely and precisely. After pasting it on the bottle, put the bottle into the incubator. The incubator should show the temperature of 37.5 degrees Celsius at all times.
So, we have now learnt the important steps which are required to be followed in any infant in which you are taking a blood culture sample. It is very important that all these steps are rigorously followed in a neonatal intensive care unit because these steps help us in avoiding the contamination of the blood culture sample. Thank you.